Okay, good afternoon, everyone. So we're going to start while the minister will join. I guess will be in a few minutes. So thank you very much for your patience and for joining this first webinar for the Global Evidence for Egypt. If you've taken part to the previous sessions, we had an actual seminar at the American University in Tahrir Square, but now we have decided to move in the cloud to make sure that more people can attend, and it becomes also a safe environment for everybody. So my name is Peter Ragno. I'm the Chief of Social Policy, UNICEF Egypt. And the overall idea of this webinar, of this initiative, together with JPAL, it's really about bringing the global evidence that JPAL has been producing over the years here in Egypt, and having a conversation and see how this evidence on different issues on different topics can really help Egypt. We had two previous seminars that focus on youth employment and also on the quality of education. And then there is this seminar which will be focusing on social assistance and shocks. So it's very relevant to the period that we are all living. I want to thank obviously the participants, but also the panelists. We will go through the panelists in a few seconds. I wanted to give the word to Alison, Associate Director of Policy at JPAL, for some introductory remarks. And then I'll give the words to Jeremy Hopkins, our new UNICEF representatives here in Egypt. Alison, over to you.
Great, thanks so much, Peter. Hi, and welcome to everyone who's joining us virtually. I'm Alison Fahey, the Interim Executive Director of JPAL Middle East and North Africa, and I'm really pleased, together with Peter, to welcome you all to today's webinar on behalf of JPAL. As Peter said, the third in this Global Evidence for Egypt series, together in partnership with JPAL MENA and UNICEF. And we're really glad to have been able to transition this virtually today. I'll tell you a little bit about JPAL MENA and kind of how the seminar series that you're joining us for today really fits into the way that our organization works. So JPAL MENA is based at the American University in Cairo, and we are the 7th and newest of JPAL's regional offices worldwide, just launched this summer. At JPAL, our mission is to reduce poverty by ensuring that policy is informed by rigorous evidence and that research is translated into action. And today's event really is kind of a perfect encapsulation of this approach that we take at JPAL. At our heart, JPAL is a network of more than 200 affiliated professors who are some of the world's leading development economists. And they work together in partnership with governments and NGOs and use randomized evaluations to understand the effectiveness of a wide range of social programs and policies, figuring out what works, what doesn't, and why. Together, this group of affiliated professors has conducted more than 1,000 such impact evaluations, generating a really rich evidence base from more than 80 countries around the world, including many studies in Egypt, to help inform policy decisions. So we're really pleased today to have William Pariente, one of JPAL's affiliated professors, with us. And he will be reflecting on policy lessons emerging from his own research on social assistance and social protection, as well as the lessons from this broader global body of research and evidence on these topics. But it's also really important to underscore that at JPAL, our work does not happen alone. JPAL always works in collaboration and in partnership with government agencies, with nonprofit and philanthropic partners, to innovate, to pilot, to evaluate, and ultimately, hopefully, to scale up more effective approaches to tackling development challenges. And so it is our government and our NGO partners' assessment of the most pressing development priorities and challenges which really guides our work. So in light of that, we're really thrilled today to be joined by Her Excellency Naveen Kabash, the Minister of Social Solidarity, to share her perspective on government priorities in Egypt with respect to social assistance. And then rounding out the conversation today, we're also really pleased to have longtime JPAL partner Nora Salim, the Executive Director of the Sawiris Foundation for Social Development, joining the conversation and bringing in her perspective on the role of philanthropy and NGOs to be working on social assistance issues and priorities. And as Peter mentioned in his opening, this conversation really could not come at a better time. With unprecedented kind of combined health and economic shocks that none of us have witnessed before in our lives, improving the effectiveness of social assistance is really critical now more than ever to support the most vulnerable households in Egypt and around the world. And we hope that by bringing these three perspectives together today, the ministers, that of Egypt's philanthropic leadership, and the global rigorous evidence from a J-PAL affiliated professor, we hope that we'll be able to identify useful insights from this global evidence that can really help to inform and to strengthen policy design and delivery to support Egypt's really important policy goals. So while we do wish that, as Peter said, that like our previous seminars, we were gathered together at the Tahrir campus of AUC for today's event, we're really glad that you've all joined us online. So thanks again for joining us. And absent the opportunity to have coffee and chat together in person after the event, please don't hesitate to reach out to us afterwards with your ideas. We hope that we'll have an opportunity to collaborate with many of you. Thanks again, and back over to you, Peter.
Thank you. Thanks, Ashley. I think Jeremy, if you are connected, if you have a few remarks, over to you.
Sure. Thank you very much. Thanks, Alison, for setting the scene, and Peter. And I'm not sure if the Honourable Minister has joined, but it's a pleasure to, in my first few weeks coming into Egypt as head of UNICEF here, to be witnessing, let's say, this exciting panel discussion with Honourable Minister and Professor William Pariente and Ms. Noura Salim from Essaouira. So, I mean, I don't really want to, I really want to just to kind of signal that, in UNICEF, we're extremely, we highly value, this, the partnership that you just talked about, Alison. And I think that it's incumbent on us, actually, with our respective mandates, to be engaging in these sorts of discussions. And as you say, it's perfect timing for this particular theme that's coming up today. Between us, we have a lot of global expertise. UNICEF is a knowledge bank on children, and then in J-PAL has a very sort of solid pedigree. And then we have the Honourable Minister with her experience, and I actually met her earlier today. And I know she has, exactly the right kind of experience to bring to a discussion like this. Together with the Saoudi's Foundation. So I'm really looking forward to hearing what the outcomes and outputs of this discussion is. I think it's great to have this forum, and in light of, as you mentioned, Alison, the particular context we're in now, Corona is by no means over. I mean, perhaps the initial shock, in all senses of the word, has passed, but we know that the impact is going to continue for several years, and that in fact we may still be seeing shorter term impacts as well as longer term. So it's really an opportune moment to be looking into what can work, what we know works from other places, what we know works here, and how we can together come up with ideas on what to do in Egypt, for Egypt, but based on global experience. So with that, I'll hand back to Peter, and thank you very much for those few minutes of the floor.
Thank you. Thank you very much, Jeremy. So a couple of housekeeping, just for everybody to know, we are recording this seminar. There is also a background note, a seminar brief, actually a webinar brief that we developed together with J-PAL, and it's going to be available this afternoon on both websites, UNICEF Egypt and J-PAL. We are going to have a question and answer session at the end of after the panelists will make their remarks. It's going to be about 20-30 minutes, and there is via Zoom a question and answer chat box where you can actually type your questions. Please, when you type your question, also specify who you want to ask the question to. We are going to start, I think I covered all the important points. So we're going to start with Dr. Niveen, which I see connected, and I want to thank her for joining us. We're going to continue with Professor William Pariente and then Noura Salim before opening the discussion. So Dr. Niveen, again, thank you very much for joining us. A pleasure to see you. And I'll hand it over to you. Thank you.
Good afternoon, everybody, and it's a great pleasure and honor to be with you. And Many thanks for giving me the opportunity for that session together. And thanks are extended also to Dr. Ashraf Hatem for his support. I'm happy to see that colleagues in other organizations, not only in government and civil society, but universities also are concerned about this issue of social protection at large. And this is our ultimate aim, actually. So thank you also for William Ferranti for having, for actually serving JPAL in Egypt and everywhere, because I think your role is very important in terms of impact evaluation at large, and that's what exactly we see in order to measure the impact of all our social programs on the impact on the families at large. Peter and actually this morning I had the opportunity to see Jeremy, so I'm happy we're communicating, and many thanks to Peter Rigi for all his constant support. I know that UNICEF is concerned about, is keen to and concerned about social protection issues and emergency. It's one of the organizations that is really providing all support in terms of emergency in the country. And our sincere and supportive feelings and regards to all the families who are affected by COVID-19 and to their families at large. And I hope the well-being and safety for you families and communities, and also the working teams that are serving in these areas. Coming up to our issue on social protection in Egypt, it's been actually a long period that we provided all the support. Maybe our support during COVID-19 has multiplied on different issues, and did not only take institutional support, but actually it extended to many other sectors, whether communities, institutions, and so on. Our interventions were expanded enough to not only cash transfers, but covering informal sector and many other sectors with temporary cash transfer. The issues of mass shelters and refugees to protect women against violence, so it's gender sensitive social protection interventions, violence or refugees or women who are hosted in centers that are receiving women who are victims of violence. We have also food and hygiene supplies, loan repayment, or supporting women who are beneficiaries of microloans and of asset transfers of the repayment issue. We also have issues regarding the nurseries at large and the tour guides, because the tourism sector is very much affected in Egypt, and not all of those who are working in the tourism sector are rich. There are actually poor also people who were serving and lost their jobs. It's not getting part of it, but they lost it at large. We have also the social insurance that complements the picture of social protection. And then we have other services on family planning, on drugs and substance abuse. And finally, we have Rapid Pro with UNICEF that was very important. Maybe it was not calculated earlier that Rapid Pro is very important that much during COVID-19. When we planned to do it, there was no COVID-19 at that time. But I think it became to be really and highly important during COVID-19. Before getting into some details about each sector, I would like to convey my warm regards to Noura Slim, Sawiris Foundation, who's not only a partner, but she's a colleague and a constant companion in development in Egypt. So I'm always a pleasure and honored to be with Noura in any other event, whether on the national or the international level. Our cash transfers issues, let me tell you that during COVID-19, we increased the number of beneficiaries by 411 households, which summed up to around 1,800,000 individuals were covered by cash transfers. And we increased the poverty score at that time to be more inclusive to people who fell into the poverty and under the line of poverty that were just above it before. So we exceeded the number, and we turned out to reach, instead of 3.2 million households, to 3.6 million households, summing up to a total of 14.8 million individuals. Mind you that 76 of our beneficiaries or our card holders are females belonging to the most vulnerable groups. We targeted those who were added to the cash transfers mostly from the elderly and from people with disabilities and from single-headed households, because we were a bit concerned about the vulnerability of these categories during COVID-19. It's not only that we increased the numbers for Takaful and Karama at large, and these households will continue with us. It's not temporary assistance, but added to this, we just added 77,600 households from Takaful and Karama, people who were rejected, actually households who were rejected. So we expanded our cash transfer to cover them during COVID-19 with 3-month period of 500 Egyptian pounds each month. This was supported by USAID through WFP. So USAID spent that money to WFP, and eventually from WFP to us. 96 of these beneficiaries are divorced women, widows, elderly, and women-headed households, and 49% of these females with children aging less than 3 years, because we're very much concerned about early childhood development, especially the pregnant and lactating mothers. Also for 40,000 households with pregnant and lactating mothers were actually reached also by additional food ration products. We were concerned about nutrition for children and mothers, pregnant mothers, or those who newly had their babies, in order to improve their health and nutrition status at large. 1.3 million households from casual and informal sector workers were provided with temporary cash transfers at an additional amount of around 2 billion Egyptian households. The informal sector, or the casual workers, it was not actually only by us, it was by the government at large, with the Ministry of Labor and Manpower, with Ministry of Planning, and with us and Ministry of Telecommunication, because we were transferring the cash through smart cards. The issues concerned about the repercussions of COVID-19 was partially poverty, and other part of it was health. So our concern about disbursement of food and hygiene supplies was very intensive, especially that based on my position, I'm the deputy board person on the board of Red Crescent Association. So actually the Red Crescent disbursed around 500,000, 500,000 hygiene kits to families in poor and deprived areas. And actually they also disinfected and did all of the food packages and social care institutions were reached by hygiene kits. So actually UNICEF greatly supported us to provide the social care institutions, especially orphanage and street children and children without care, with not hygiene kits, with sheets, with many other, furnishing them with furnishing their beds and their health and anyone accommodation needs. Concerning the nurseries, because nurseries were very much affected, we just closed off. Apart from all of the procedures and the recommendations about hygiene issues, social distancing and everything, this is aside. But in our nurses, we have around 14,000 nurses who fall under the supervision of MAS, added to another 11,000 who are not registered, but they are serving their mission. So there is 126,000 let me say, supervisors or facilitators working in these nurseries. We covered them with 3 months payment. And we also covered around 9,000 tourist guides that registered of being below middle class, and actually they lost their jobs and they didn't have any other source of income. But this is temporary emergency fund only for 3 months. Then we come for the facilitation of loan repayment for indebted women and for women who are covered with SMEs and asset transfers. So there was a repaid late installments for 1,460 indebted women, mounting up to 5.5 million Egyptian pounds. And thank you very much for Sawiris Foundation that actually they provided us with sort of economic empowerment tools and asset transfers to women, poor women who were affected by the situation. They also covered Red Crescent with around 18 cars that serve as first aid and life-threatening issues. So actually, that's emergency interventions. Not only the 18,000, but provided us with lots of issues of hygiene and training of government and non-government officials on keeping themselves safe. As for the social insurance pensions, most current situation that it disbursed social insurance pension for an aggregate of around 7.4 million beneficiaries, summing up to 10.1 million pensioners. So because, I mean, one profile can include more than one person. That's why we have 7.4 and then 10 million pensioners with an aggregate monthly cost of 8.2 billion Egyptian pounds. Most interventions after COVID-19, it has taken multiple precautionary measures to secure the disbursement of monthly social insurance pensions during the COVID-19 pandemic. Actually, we availed diverse channels of disbursement. ATM was free of paying any fees. This was in coordination with the Central Bank of Egypt that led to electronic payment of 60% of the pensioners were using ATM, which did not happen ever before. So it was a good opportunity to propagate and to promote electronic payment and mobile wallets. The pension beneficiaries were divided into categories according to the values of their payment. We distanced between those who are paid less, who have a low level of pension at the beginning, and then followed by another sector, followed by another sector, in order to have social distancing. UNICEF was actually came in the right time in terms of Rapid Pro. The ministry has recently launched the interactive communication platform in collaboration with UNICEF, which enabled MUS to create direct communication channels, especially with community workers, that actually our tools in the field in order to convey the right information of people on the hygiene, health, nutrition, on education, on everything that is related to raising the awareness of people. We have 12 awareness messages on everything. So it is for the best interest for children is to protect and to constantly communicate with community workers. These community workers were 2,000. Lately, we had an approval from the president to increase them from 2,000 persons to 9,000 persons, because we're very much concerned to raise awareness on the different issues. And many of them are concerned, are keen on children, women messages, and especially protecting young children from FGM, early marriage, illegal migration, drugs and substance abuse, and so on. As for the family planning, we're contributing to the national program on family planning with a project that's called 2 Are Enough, 2 Children Are Enough. So the project actually targets 1.1 million women from families benefiting from the Careful program in 10 governorates. So we're expanding more and more in the other governorates as well. But we were keen to actually to propagate and to distribute family planning tools during the COVID time, because people and women did not have the audacity or the courage to move out of their houses to go to health clinic in order to have a family planning tool or to visit a gynecologist. So actually we provided them with the services and with the helpline benefiting from different issues. So we strengthened then the role of civil society in providing these services and raising voluntary efforts to confront the population increase problem, especially during the time of COVID. We increased the number of clinics that are providing health service and reproductive health from 31 to 64 clinics. These clinics are actually supervised and cross-checked with the quality service by the Ministry of Health and Population. Since the door-to-door and seminar activities were suspended during COVID-19, so we had a new awareness raising phone call activities as introduced by community workers or by also telephone awareness of ways to prevent coronavirus and online facilities. The number of beneficiaries from this activity is around 700,000 women. When I say 700,000 women, actually each woman had a trickle-down effect on other women. So I mean, by that we're reaching more or less an average of 2 million women in our communities. Also the mass shelters for female victims of violence and also for refugees were provided with either phone call or psychological support through Chaiselong. And Chaiselong is an online platform that offers free counseling sessions for the shelters stay in remote beneficiaries. Finally, the lasting intervention that we have is combating drug and substance abuse, because I think the recovery part, we did not want to lose it. To lose those are in the process of recovering from drugs and substance abuse. So during the COVID-19, so we extended the work periods in our outpatient clinics with the presence of specialists who supervise social distancing between patients and volunteers. We provided them with the needed medication. Actually, we found also volunteers that provide these medications up to their homes for people who are not able to come to the centers to take their medications. There was also online psychological sessions, continuous sterilization and disinfections of clinics on daily basis, preventing visits and vacations for boarding access, and finally developing addiction rehabilitation services remotely. It was very much innovative, whether a psychological rehabilitation program for addiction patients through an e-platform, or online sessions, or the continuation of the call center hotline to provide psychological support to the recovered patients 24 hours a day. I think in brief, to wrap up, the issue of using the online communication came to prove itself more and more important during this period. And we know that poverty, our methodology and our approach of poverty is multidimensional. We realize that not all of the people are connected and do have the luxury of accessing knowledge and technology. And that's why it was a challenge for us in the villages. Yes, we resort to NGOs, but it opened our eye wide that we need to be more accessible to the villages and hamlets that are deprived of this. I think our coordination with NGOs was great during that period, especially that we developed an online unified database on the interventions actually of not only the ministry, but the ministry and the bunch of NGOs. And from that time that we thought of having a unified database on all the interventions, not only during Corona, but post-Corona. Thank you very much for giving me the opportunity. I'm sorry that I was running from one aspect to another, but I did not want to lose an opportunity to share with you, and in the meantime to keep my time committed and to comply with it. So thank you very much, and I'm here following up with you in terms you have any question or inquiry. Thank you very much. Can I just thank my colleague Amina? Amina is, how do you call it, Minister's Associate? Is our young, enthusiastic and strong Minister's Associate, but she helped actually in pulling this information together. So I publicly thank you, Amina, for all the support and the good work that you're doing with me. Thank you.
Thank you very much. Thank you for these remarks. I think it's very clear that the government response went beyond the cash transfer of Takaful and Karama. It really tried to tackle and use the different channels, like let's say the pension schemes, as well as creating some temporary schemes for like the Ministry of Manpower scheme for informal workers. I also think that, as you mentioned, I mean, in some cases, it's not only about adding new beneficiary, it's just making sure that the beneficiary, the existing beneficiary, can keep receiving the benefits, because that's in this particular crisis was also a major challenge. And also I noticed that you are also transforming this crisis in some opportunities in pushing on online platforms, electronic payments. And I think that's also a learning that we are seeing in other countries, transforming this into an opportunity to speed up changes in how we do business. So thank you very much. I mean, I thank you very much also for staying. I'm gonna give, it's I think William, if William is ready now, we can go ahead with William and Nuran, and then we can have some remarks, some feedback from Dr. Niveen to both your presentations. Over to you, William.
Thank you very much. Thanks. I'm very pleased and honored to participate to this seminar in presence with the Minister and the representative of Sawiris Foundation and UNICEF. So today in this presentation, I would like to show some recent rigorous evidence on the impact of social programs for the poor. And this rigorous evidence can be very helpful to understand what type of program works, but also to guide us on how to implement those policies and those social assistance policies in the most effective ways. And so we'll see that in the many examples that I will provide, that actually the details can matter a lot, and the details of implementation. Next slide, please. So the outline of the presentation is as follows. I would like first to briefly present the type of social assistance that has been developed in many countries over the last months in response to the shock. Then I will try to explain a little bit how we generate the rigorous evidence on the impact of those policies using a specific method that is called randomized evaluation. And I will just briefly explain what we mean by that. And then, of course, more importantly, I will synthesize this evidence on social assistance program and try to present the main takeaways on how to best shape those policies, especially in the time of shock, such as the COVID shock. Next, please. So I would like to start first with an overview of the social assistance programs in the context of COVID. Next, yes, perfect. So as we know, the COVID crisis had like an enormous impact on the poor, and the poor in many developing countries actually lack access to formal insurance, to credit. Some have access to safety nets, but not all of them. And that makes them very vulnerable to different types of shocks. And as we've seen, there has been huge impact on health, but there has been also impact beyond health. And we know that there are going to be probably some important consequences of the shock, more on the economy. And so it's not just linked to government restrictions or lockdown. It's also due to the fact that there is a big shock on supply and demand that are occurring now. So some estimates from the World Bank has shown that like between 40 and 60 million people are in the risk of falling into extreme poverty. And there are even like more pessimistic estimates than that are like circulating in the last days. And if we look at data from Egypt, just like survey information, we see that the vast majority of Egyptian families have seen a decline in their income over the last months, and also have seen their working hours reduced. Next. So as a result, many countries have actually expanded or enacted social protection programs. There are like different types. There are like labor market interventions. There are like social insurance programs, like, for instance, like unemployment insurance. And there are, of course, social assistance program, which consists in transferring some resources to the most vulnerable population, like cash or in kind. This can be done like digitally, or it can be done like physically. So here, all those programs of social assistance account for the bigger part of the response in terms of social protection. Next, please. So today I will exclusively be talking about what the global evidence has to say in terms of social assistance policies, and more precisely also about cash transfers at some point. That has been one of the largest response to COVID. And again, according to the World Bank, this constitutes cash transfer like nearly 50% of the social assistance program. 18% are like in-kind transfers. And what is interesting is that among the cash transfers during the COVID period, almost 68% of the programs are actually new programs. And so that could also have potentially an effect on mitigating the impact of the shock. Next. So it is important to note, of course, that those programs are not necessarily always new. So in the last 20 years, there have been like an increased number of policies that have been implemented in low and middle income countries on social protection. Of course, there is heterogeneity in the type of answers, but this is not something necessarily new. And some governments, some countries can build, like Egypt, on those type of programs that were pre-existing the shock. Next. So here, the key question that I would like to discuss today is how can we shape and maybe modify or enhance the existing social assistance program in response to COVID and other shocks. And so can we like change the type of flexibility or can change the way we target beneficiaries? These are all really important questions. And in order to answer to this question, we are mainly going to look at whether the past evidence and the current evidence is telling us in what works and what doesn't, and how can this inform like future policies. So before going into the analysis of this evidence, I would like briefly to spend some time on the method that we are using to generate this evidence. Next. So at JPAL, we use one method that is called randomized evaluation to find out whether programs work or not, and more importantly, why they work or why they do not work. So this is really the approach that we're going to take to understand whether social assistance program work or not, or could work better in the wake of the challenges that are imposed by COVID-19. So here in this slide, I would just like to give the basic intuition of what is a randomized evaluation. So let's say that we have a population that may receive a cash transfer program to improve their well-being. So what we would like to measure, of course, is whether this is true, whether the program really affects their consumption level, their income, their well-being. So here there are different ways of doing this. First, we could maybe like follow these people in time and see whether their consumption after the program is greater than their consumption before the program. But of course, by doing this, we'll not be able to know what is the impact, because many other things might have happened between these two periods, such as like a different economic environment, like other shocks, other policies. Another possibility would be to say, okay, we have those people that got the program. Let's try to compare them with a group that did not receive the program. But here, again, that would be potentially a problem, because the people that participate are maybe different than the ones that do not participate. In that case, maybe they are poorer, and maybe those people are more informed about the program, so then comparing the two will not really work. So what would we need in an ideal world? We would like actually to compare the outcome of the people that got the cash transfer program with their situation if actually they did not participate. Of course, this is impossible because we don't have the two states in the nature, but we can try actually to achieve a similar goal by randomly assigning individuals to either receive the program, that would be the intervention group, or not, and that would be the comparison groups. And because of this randomization and conditional on having a sample size that is large enough, we are confident that actually the two groups will not be systematically different on average at the beginning of the studies. So that makes sure that before the beginning of the program, the group that will receive the cash will not be better off or worse off than the group that does not receive the cash. And so after randomization, of course, the program is only implemented in the intervention group. And because here, the only difference between the two groups is their participation to the program, when we come back like 1 or 2 years later to follow this population, if we find any differences between the two populations, we'll be able to say that this is due to the program and not to any individual characteristics or other characteristics. And so the power of this type of method is that it allows us to really evaluate the added value and the effect of the program. Next. So here, this is a method that has been used a lot by our researchers. And here you see on the slides that we have more than 200 affiliated researchers that are based at leading universities all around the world. Next, and our network of affiliate has carried out more than 1,000 randomized evaluation in 89 countries. And here you can see also that for many types of intervention, J-PAL has really contributed to the production of a very large body of evidence. And this is important because with this body of evidence, we can really provide policy lessons and inform future programs and policies. So this is true for education, this is true for agricultural programs, this is true for finance effect on financial programs, and this is true also for social assistance. So here, next, so in this graph, you see the number of evaluation on social assistance program that have been carried out by J-PAL affiliates. And so here you see that a majority are done on conditional cash transfers, but there are also some evaluation on unconditional cash transfers and the graduation approach that we'll discuss later, and also in kind transfers. Next, so most important, so now, having introduced the subject and the method, so now what can this evidence tell us about social assistance strategies? Next. So here, most of the evidence on the past on really the effectiveness in terms of impact are on conditional and unconditional cash transfers. They come, this evidence, from the normal time, if I could say it like this. So here, there has been a large number of studies showing positive impact on consumption, schooling, or nutrition. There are maybe a bit more mixed evidence, for instance, on the effect of providing cash grants to small businesses and also on the long-term effect of these cash grants. But that's true that to know whether those effects that we find in the recent past would sustain during the shock that we're experiencing, that is very of course, particular in many, many dimensions, is still really an open question. Although we have very few evidence that just were just released a few weeks ago on some programs that were implemented before the shock, and where the researchers have been able to follow the population after or between and after the shock, or still during the shock as it is today. So for instance, in Kenya, there is a group of researchers that have been evaluating the effect of what is called universal basic income, which are actually 3 different interventions, which can be like a lump sum grant, a long-term transfer, or a short-term transfer. And what they find, using survey data from a phone survey, they find that the program has a positive effect on well-being and on food security. But at the time of the survey, the effect on the economic activities is a bit more nuanced. And one reason is because the program helped before the shock to diversify the type of activities the beneficiary had. So they had newer enterprises, other businesses that could be, of course, affected by the shock. We have also some evidence in Malawi, which is very, very recent, that shows also that there is a modest but positive effect of cash transfer on food security as well. Here, the difference with the earlier example is that those cash transfer were given before the shock, actually, not necessarily during the shock. But still, we find a positive effect on food security in this study. Next. But beyond this very recent evidence, and probably much more will come in the next months, but that's not, we don't have that much more for today. Beyond this recent evidence, I think there is a lot to learn still from the past evidence. And here, there is a lot to learn not only on the impact, but also really on how to implement most efficiently those programs. And so here there are like 5 different takeaways that I would like to discuss during this presentation. There are like takeaways on targeting, so who should we target and how, on the beneficiary experience, meaning like how the beneficiary should be included in the program, what type of information should we give them, on what is the role of conditionality, because many cash transfer programs have conditionality, are they important or not, could we release some conditionality, and also I would like to discuss like other type of programs that go beyond cash transfer, but that are more costly and that are a bit more intensive, like the big push assistance policies that have been developed in different parts of the world and also in Egypt. And then I would like to finish with discussing quickly also the challenge from going to the pilot phase to large-scale phase when we do an evaluation. So the first takeaway that I would like to discuss is really on targeting. As you know, many social assistance programs like target a very, of course, specific population, and there are very few programs that are universally provided. Next, so when the population that is targeted is generally a population that does not have access to the labor market. But of course, during the COVID shock, we know that many people beyond those that are not in the labor market are affected, of course, by the crisis. And the governments might be really also interested to target beyond the very poor, but also target people that have lost their jobs. So in some countries, of course, there are already some social registries that exist, and it can allow the government to give a very quick response. But again, maybe we might want to target people that have been subject to the shock that were not identified before. Okay, so here there are like different methods to target the poor people, such as proximity testing, such as community targeting or self-targeting. It's worth to mention that there is no like perfect method that dominates all the others, but I think I would like to discuss some of the characteristics that could really matter at the time of COVID. So for instance, with proximity test method, which are based on some characteristics that predict consumption, such as like household assets, size of house, or education. Here, the idea is really to capture the permanent part of income. And maybe they are not really able to identify income shocks, which may be very important today. So that's why maybe other method could be a complement to this type of targeting method, like community-based targeting or self-targeting can be like some alternatives. Next. So the idea of the community targeting is really to give each community a fixed number of slots and allow the local community institutions to identify the beneficiaries. So here the advantage is that it allows to use local information and not miss, for instance, like transitory or recent income shock. Of course, there might be also different definitions of poverty between government and community, and this would also help to identify poverty as defined by the local communities. Of course, there is a risk of elite captures, but one thing that is important also is that if the community perceives that the PMT does not select the right household in needs, of course, it can create some tension and some legitimacy problem. So here I would just like to discuss about one evidence in Indonesia that is evaluating the different methods of targeting and like proximity scores compared to community targeting, for instance. And what they find is that actually the lists of poor people that are included after these two types of targeting method, they are quite similar. And in a way, it's the targeting does with community targeting does as well as the targeting with the Proximin test scores. Next, so here, one additional advantage of community targeting in that case is that the community targeting really led to a much higher community satisfaction. And so here you can see in this graph that with the different color that actually the blue one are the one linked to community targeting and the red to PMT targeting. It shows that actually individuals were much more satisfied with the community targeting. They wished to make very fewer changes in the list of beneficiaries, whether adding or excluding some beneficiaries. And also they had the possibilities to file some complaints, and the people in the community targeting group were like manifesting much fewer complaints than the other type of targeting. And so on top of that, this analysis hasn't shown any elite captures of the community targeting. So here, what is interesting is that it shows that community targeting can improve the satisfaction of the community, and it doesn't really have a big effect on accuracy in terms of like selecting the wrong people in a way. And so here, when we look at this different method, we could also argue for the fact that community targeting is also able to capture some of the transitory shock that maybe PMT wouldn't be able to do so. So that's one first takeaway. A second takeaway I would like to discuss is when, next please, when the beneficiaries experience the program, the way they experience it might also affect the impact that we get, and can affect also the effectiveness of the program. And something that is quite common to a lot of programs in the world is that beneficiaries that are eligible for a program might not be really aware of its existence, or might not be aware of all the conditionalities that are linked to the program. And this is a really important question in some cases, because we might miss part of the population, or we might not give the benefits to the entire population that is eligible for it. And so here the question that is highlighted in this example that I'm going to give in Indonesia again is whether actually sharing program information with beneficiaries can improve delivery. And so here, this is the example of the program that is called Raskin in Indonesia, where the government spent more than $1.5 billion each year on a program that has the objective to give the possibilities to eligible households to purchase 15 kilograms of rice per month at a very subsidized price. And so it concerns a very large population in Indonesia. And of course, administration of this type of program has many challenges. And so here, in the challenges they had before the evaluation is the fact that there was a lot of leakage, so lost rice. So some eligible households just really received part of the benefits. Some people, like I said before, were not aware of the rules and the eligibility criteria. The targeting was not necessarily well done. Some figures have shown that many ineligible people had actually access to the program. And another issue is that there were a problem with prices. So the local officials actually inflated prices. And so eligible household paid on average like 40% more than what the official price, subsidy price was given at the beginning. So here, to overcome these challenges, the government of Indonesia, in collaboration with a group of researchers from JPAL, actually thought about an intervention which consisted in mailing identification cards to eligible households in some randomly selected villages that were part of the evaluation. And so here, in the basic treatment, those cards would really inform about the eligibility and the quantity of rice entitled to each household. And so they also tested the impact of the cards when the cards would also include information about the official price, the subsidized price, and when this information will also be made publicly available at the community level. And so what they find is a kind of really a striking result is that when those cards are sent to household with the information about the price of the subsidized price of the rice, then they show a very large increase in the percentage of benefits that have been received. So here we see like a 26 percentage point increase in the benefits received. So here eligible households like received more rice and paid also a lower price. So here adding the official price of rice to the cards really had a huge effect and huge impact on take-up of the benefit. So this suggests that information improved also the bargaining abilities of the citizens. And interestingly, this has shown that this type of intervention was highly cost effective because of course, the estimated increase in benefits for households and also the fact that there is a less elite captures in a sense or less corruption is of course a huge benefit compared to the cost of sending these cards. And so here this is typically the case of an evaluation that was really like giving like interesting results that inform then a national policy decision. So in part based on these results, this intervention has been scaled up for the entire countries. And so 15 millions of low-income households in the country received this type of identification cards. So here, the takeaway is that making the beneficiaries really part of the process can really improve the impact of the social assistance program. Next, a third takeaway that I would like to discuss is really on the role of conditionalities. So for a while, conditionalities have been seen as really one determinant of success of conditional cash transfer program. And as here the question is whether this is really the case. So this is an important question today because during the pandemic, many countries are actually loosening conditionalities. Why? Because it's hard to enforce the conditionality during this time because of capacity constraints, but also because it might not be a good idea to make people go to school or to a crowded hospital at the time of COVID. So here there are maybe also some incentives for education or health that are not as simple as they were like a year ago. And so that may not be actually a bad thing because we are not totally sure that conditionality is always necessary, okay? And so one example of that is an RCT in Morocco that tested in opposition to conditional cash transfer, what we can call a labeling cash transfer. So a framing linked to the transfer with a particular purpose without necessarily having like the conditions that are needed to receive the transfer. So here, next to the transfer was actually an advertising campaign with a flyer, which was on a pilot program to fight against school dropout in Morocco. And so this is why it's called a label cash transfer and not a conditional cash transfer. And by just using this label, it's interesting to see that you have like some effects that are actually larger than the effect of the conditional cash transfer, especially on school attendance, but also on learning outcomes. So here, this is suggesting that the label shifted the behavior by increasing the salience of education. Okay. So there is also another example in Uganda where research has shown the differential effect between a conditional cash transfer and the unconditional cash transfer still linked to education outcome. And so here what they find is that the conditional cash transfer is more effective to increase education outcomes, but the unconditional cash transfer had larger effect on some other outcome, like for instance, reducing marriage amongst schoolgirls or childbearing rates. And the reason is that because those girls who did not comply with the program and who dropped out actually still received the benefits and could actually still gain from it. And so just to conclude on that, conditionality has been seen as a tool to ensure general buy-in from the public over the welfare payment for the poor, but there is some tension between the incentives effect and also providing income support. And so which one to emphasize will really depend on the context. So there is growing evidence that we may not want to enforce conditionality as strongly, but maybe think more about messaging over like general transfer programs. A final takeaway, at least on the program that I would like to mention, is beyond cash transfer program, there are also other types of programs that are taking like a more holistic or big push approach to try to overcome several constraints that very poor people face and to overcome them at the same time. The assumption here is that by giving like different type of intervention, then poor people could be lifted out of poverty. And some of these programs have actually shown that they had like large and lasting effects on the living conditions of the poor. So the origin of this program is really the graduation model that started with BRAC, with targeting the ultra poor in Bangladesh in 2002. And it has been then like replicated in several countries. And so here the idea of the graduation program is really to try to overcome like different constraints at the same time. So here the idea is to transfer productive assets that people of course could not buy without the program, but then to complement this with some technical skills to make sure that people use correctly the assets, to give also regular cash or food support so that that reduce the incentive to sell the asset in times of shock. But there are also other measures such as like access to savings, to encourage households to cope with unexpected life events in the futures, but also frequent home visits from the program to encourage and also to coach the beneficiaries. And there is also a component on health education. So J-PAL affiliates have conducted a randomized evaluation of this program in many different contexts. And what is striking is that for most of the contexts, in the short and in the medium run, we find really large effect of the program. And so here, what is shown is the short and the medium run effect for like 7 different sites. And we find like a very important effect on food security, on consumption, on asset holdings and savings. And what is, I think, very important for most of these projects is that actually when the asset has been transferred, when we look like 2 or 3 years after, we don't see that people don't have their assets anymore. They still do have their assets and still get some gains with the asset they had from the beginning on. So that makes us confident that this program might be having effect that lasts over time. So for the sake of time, I will skip this slide and I will go directly to just to introducing the BabAmal program that Noura Salim will present in more details in a few minutes. So just to say that this program has been also implemented in Egypt in 2 different governorates. And I would just like to maybe explain a little bit the few data that we have. So if you can maybe skip 1 or 2 slides, please. Yes. So yes, so here, so these are the few baseline characteristics that I would like to show on the participant of this program in Egypt. So the current study is really ongoing. So unfortunately, I don't have any results to share with you yet, but I hope we will be able to do in the near futures. But I just want to say that the population that has been targeted with a kind of a hybrid method between community targeting and mainly proxy mean test scores method, we have a population that is really like very poor. So the majority of the household head are illiterate. 8% of the household are headed by a female. Although most of the household have access to electricity, only few have access to water at home and to improve sanitation. Next, we find that household members who work are generally males. Few are involved in agriculture or craft, and most of the households members are actually working in unskilled wage work. And very few also are self-employed in agricultural or non-agricultural activities. And finally, to finish on this, their level of monthly consumption is very low. According to a survey, it's 227 Egyptian pounds, which is like per capita, which is below the poverty line in Egypt. But of course, one caveat is that our measure of consumption is not exactly the same as the one that is used in the CAPMAS survey, for instance. It's also worth mentioning that more than half of the sample has a member that has received the cash transfer from Takaful and Karam. But I will leave Noura Salim discuss the program in more detail in her presentation. So just maybe to conclude in a few words, I just would like to say that there is another takeaway, another challenge that we need to have in mind is that when we evaluate at the pilot level, we get some results. And here the question is whether those results generalize when we actually extend the program at the country level or in a different context. And so here there are like different concerns that could actually affect the result. There could be a change in government's behavior because if the program is becoming like a policy, it might crowd in or crowd out some government actions. We know that cash transfers may also have general equilibrium effect, meaning that it could affect the rest of the community. For now, what we have seen from the evidence doesn't seem that it has like a negative effect on the people that do not benefit from the cash transfer program directly. And the last thing is that when we go from pilot to large scale, there are of course different processes that needs to be implemented. And this might also make the implementation, of course, more difficult, and this needs to be taken into account. So just to conclude, there were like these 5 different takeaways on targeting, on beneficiary experience, on the design of conditionalities, on programs beyond cash transfer, such as like big push assistance policies, and evaluation challenges when you scale up a policy. So I will stop here, and I'm looking forward to discussing this in more detail in the Q&A session. Thank you very much.
Thank you very much, William. Thanks. I mean, very informative. I think we will probably share the full presentation also with the participants, which has a lot of interesting information, but because of time, you couldn't go through much in detail. I mean, what it comes out very clearly is that is not only about adjusting the program after a shock occurs, but building some elements of responsiveness and resiliency in the program during a time of non-crisis. And you mentioned about the program was very effective when they diversified incomes within a family. And I think that's what we need to think about when we think about social assistance, is building programs that are shock responsive in periods when there is no shock, to make sure that when something occurs, people are more resilient and more able to respond. So thank you very much again. Noura, if you're ready. So over to you.
Thank you, Peter. And first, thank you very much to JPAL and UNICEF for the invitation. It's really an honor and a pleasure to be with you all today. And I've learned a lot from William's presentation as well. So thank you very much. It was very informative. And before I start, I just want to thank the Ministry of Social Solidarity for their long-term partnership, and particularly Her Excellency Minister Dr. Naveen for all her very kind words, but also great support for the NGO sector at large, and definitely for Sawiris Foundation for Social Development. And with that, I want to start perhaps with, as Sawiris Foundation, we have 3 different studies that are basically 2 that are almost at end stage, and 1 Bab Amal that is currently in implementation in partnership with JPAL. And for us as a practitioner, as a development organization, we care very much about learning, about investing in knowledge. It does take time, it takes financial resources. However, we believe that to really maximize, let's say, the biggest bang for our buck and our duty towards the beneficiaries that we serve, it's very important as an organization to learn and therefore to better invest our own resources, but to hopefully also produce, knowledge products that are public goods that maybe help the development sector in Egypt at large. Because I think as we look at global evidence, I think the evidence from Egypt as a big country, I'm hoping to see more of it that we can contribute to as Sawiris Foundation, but that others contribute to as well. So I want to thank JPAL for their partnership that we really cherish and the knowledge that I think we're creating together. So let me focus on Bab Amal in a few words, really focusing on both the key dimensions as well as the key learnings. So as we've worked 19 years in Egypt, focused on economic empowerment, which was the goal and is the goal of Sawiris Foundation, what we have realized is that economic empowerment, and our definition of it used to be a lot of investment in skills training, in job placement, in some mentorship, and in support through training and access to finance for youth to start their own businesses. What we have realized, particularly as we have expanded our work in Upper Egypt, is that this alone, even if it works in the short term, probably does not sustain in the long term. Why? Because I think we all see that poverty is really multidimensional, particularly as we move in the poorest areas of Egypt. And for me, a great and seminal report was UNICEF's report. It was focused on multidimensional poverty of children, but I think we can extend that to not just children, but many families. In that report, maybe 8 dimensions of poverty, but I think that a lot of them are applicable at a family level. So basically what we decided to do as Sawiris Foundation was to take on the challenge of, one, focusing on the ultra poor, so the poorest of the poor, and really trying to do this in a way that benefits from what has worked elsewhere, but contextualizing it to Egypt. And thus was the idea to use targeting the ultra poor, which is not a Sawiris initiative, but is rather a BRAC, Bangladesh-based BRAC's initiative, and one that, as William has said, has been covered extensively by JPAL in research and by others as well, and has been proven to be successful across multiple dimensions and outcomes, but more importantly, has proven to also sustain. So basically, the program for us has at its core the technical skills training, as well as the provision of a productive assets, which I think is common across many organizations and government programs that work on economic empowerment. I think what is unique is adding, one, social protection, which again, for us, even as we look at our own database, as William mentioned, 50% of them are Takaful and Karama recipients. So the ministry itself obviously has a very successful, very encompassing Takaful and Karama, which already basically guarantees the element of social protection. For us, this cash transfers needs to stay for at least a period of 6 months. As a result of COVID, we've extended that to allow the participants to become actually economically productive through their assets. So social protection is the second element. The third element is social empowerment. And social empowerment is incredibly important as we look across the fact that those people will only really come out of poverty if they're socially empowered, and even socially empowerment encompasses a lot of things. There as well, we really wanted to work closely with the ministry and to benefit from WAI, which is the program that the Ministry of Social Solidarity launched to increase awareness, as the ministry had stated, across a number of very important topics. There are actually 12 messages. And so we used WAI already as a basis for the part around awareness around family planning, around awareness around education, around children, around several key messages. And that's the core of the social awareness component. And financial inclusion, which obviously I think is a priority for Egypt, is a priority as we look at Egypt Vision 2030, is a priority as we look at a lot of research that relates financial inclusion to development indicators and poverty alleviation. And so for us, financial inclusion, and in our program, it is defined through both extending financial literacy, but also provision of access to savings. And there we are utilizing both the SLA model as well as post offices where I think a lot of work people tend to in general save. So social protection, economic empowerment, financial inclusion, social empowerment are the 4 sort of core components. But then I think a fundamental aspect of the program, and it's I think the part that is quite costly as well, but very critical from what we've seen so far, is the coaching. So for these households, and as we think about people in extreme poverty, and as we look at the program and including the shock that we all experience, but that particularly poor people experienced of COVID, I think if it weren't for the coaching, if it weren't for the very heavy, I would say, hands-on hand-holding that has been provided by very well-trained teams that have been working on the ground in Asyut and Suhaig, in the villages that are from the villages, that have been trained by us, by BRAC, by the ministry on WAN, I think the program would not have been definitely been able to continue, at least throughout COVID. So I think coaching is a very important metric that for us perhaps even ranks as sort of top as we look at the impact of the or I will not use impact in such a setting so lightly. So as we look at the results of the program today. Our experience with JPAL has always been, there's always been an additional challenge deployed. So I think while we are very happy with how Bab Amal has started, similarly to our first study with them, which was a job creation competition where we were looking at loans versus grants, as you know, sort of 6 months after we started, the devaluation happened. So sort of it puts a key shock into your analysis and your results. Similarly with Bab Amal, you know, we dispersed the productive assets, but then COVID happened. And there, I think the important lesson of flexibility and the important lessons of extending social protection beyond what was planned has been important. So we had extended then our cash transfers beyond the initially planned 6 months. And there may be additional adjustments. As I said, we're still in implementation. So we are flexible. We are prioritizing the need to really, you know, elevate poverty. And so there may be additional adjustments. I just want to close with, you know, a few learnings beyond the design and the plan for the program. I think for us, what we have seen very prominently, I know William showed 60% illiteracy, but it's not just about formal illiteracy. I think the level of, you know, lack of awareness across multiple dimensions that we see, particularly as we work in this segment, is alarming. So we see a lot of families, you didn't get into family size, but I think we see very frequently a family with 10 children, with 12 children, with a minimum 8 children, as we look at the poorest villages that we work in Suhaig and Asyut, which is obviously then really very difficult for those families beyond whatever sort of economic empowerment you're going to generate at this family size becomes very, very challenging. We see a large incidence of disability, and I would definitely be curious to see if the data, how this is sort of versus national average, because I would assume and I would hypothesize that it would be quite high. Very limited in terms of this family's knowledge as to how to deal with the children with disabilities, etc. And definitely a huge need for mobilizing the whole community beyond the program. So I don't think that these poor will manage to get out of poverty just through our initiative, which is why I think as we've all been working collectively with the NGOs that support us and that are partners in this with the ministry, the importance of linkages with the healthcare services that are provided by the healthcare ministry and the Health and Population Ministry, the importance of linkages with the educational ministry as we look at, you know, how education is for those children in those very poor villages, the importance of really mobilizing the community. And we have created in each of those villages what we've called social solidarity committees that are a lot of sort of the key stakeholders in each of those villages, trying to liaison obviously with all the offices of the Ministry of Social Solidarity there as well, because I think that it has to be that here are the 5 components of Bab Amal, but here are all the linkages that we were able to create as we have mobilized the community, as we have mobilized, you know, other government services, because the issues that they face are really huge. And again, if you get a healthcare shock, we're not directly addressing healthcare in this program. If you get a healthcare shock, it will just push them back into poverty. And so we're conscious of not just the work that we do, but the linkages that we can create. And really the goal of the program is a pilot program. It's a costly program when you look at $1,000 per household, which is the price of household for us. But I think one of the key questions we're looking at is cost effectiveness. So my hope that we would come back and say that while this program, if you just look at the nominal cost, looks, you know, expensive for Egypt, but that the cost effectiveness was really worth it, and that we can come up with policy recommendations, and not just for government, which, you know, we're honored to work with closely, but also for other NGOs that work a lot in villages to say, you know, maybe it's an additional cost, but look, your results will sustain for 3 to 5 years. But look, this has meant increasing consumption for those households, you know, 5x. That the results would justify the complexity of the program, as well as the costs involved. So, you know, we're honored to start this experiment as Sawiris Foundation. And we definitely need to succeed because these are sort of people's lives that we work with. It's not just an experiment in isolation. For us as a practitioner in Egypt. And with that, I thank you very much for everyone's cooperation and partnership, because I think it would not be successful without many partners playing different roles for this program to hopefully succeed. Thank you so much for your time.
Thank you. Thanks, Nora. I think you raised a couple of interesting points. I mean, the fact that poverty and the problem is basically multidimensional. It's not only about income support, and how you built in the program the coaching, which I understand it seems to be probably one of the safety net for some of these families that have been affected by shock. It will be really good to see it if that will be captured by the impact evaluation also of JPAL, because that would be very interesting. You highlighted the flexibility of a program. I think that's also, we saw it in the government interventions in terms of relaxing the conditionalities and so on, and also the investment. I mean, I think as a program, the TUP, it's a pretty expensive program. It's much more complex than a cash transfer, but it's really about a sustainable poverty exit. It's really about making sure that those families that are into these programs will not be beneficiary later on if a shock occur at family level or at national level, a community level. So it's really about investing now, not to have those households to fall into poverty and again target again through other programs. So it's clearly an investment, and there's a choice that the governments need to make. So again, thank you, Nora. I think I want to thank all of you for your remarks. I mean, I think let me highlight again that this seminar, this series that we have, it's also it's possible thanks to the support of Allianz, which is our partner in this initiative. There are a couple of questions, but before going to the question that we got from the participants, I wanted to see if Dr. Niveen has some remarks from William presentation or from Nuran remarks before I move to the questions.
I have one question about labeling regarding the conditionality, because I know that it's a long discussion between us as MOS and UNICEF regarding conditionality. I'm also pro not having it tightly applied, but I mean, in a country, you know that the literacy rate among the Careful and Karama program is actually 63% literacy. And regarding those who are graduates from university, it's less than 1%. It's around 0.7 or 0.8. So mind you that dropping out from schools, the percentage has decreased by applying the Careful and Karama program, although that during COVID-19, I mean, it hindered our intensive efforts because before conditionality was not applied really, it was more or less selling the cause. But I would like to know more about labeling. And the second question is actually targets both William and Nora's presentation about the graduation parts, because the classic way of having people with asset transfer of husbandry and little projects that do not really get them out of poverty as much as provide them with subsistence level. So, and that's why we're trying to get out of the box as MOS. It's not yet tested to have something like incubators or something like, productive units that are linked to private sector. It's not tested yet, but the only thing I can assert that many people in Egypt take the SME or the micro loan and then do not really do the project. And even if they do, they just have a little amount of money that is not sustainable and does not really prevent them from shocks. So if we are thinking of something that would eventually strengthen local economy and link the villages to keep people in the villages and not get them out to the districts or to joining factories or industrial zones outside the city. And then they have the issue of urbanization, moving out from villages to urban areas in order to gain their living better. So I don't know, but I think in your presentation, William, there were countries that really did great, like Ethiopia, for example, and India, where it was clearly indicated that they got out of, or the graduation program, they caused more economic lasting impact or more broad impact. It's different than Peru, for example, or than Honduras. So what is the real, cut-off indicators that make a country really successful in graduation and another not? Thank you very much.
Thank you very much for your question, Dr. Naveen. I'll let William and Nora respond. If you can be a bit brief in your answer. Please, William.
Thanks for the great question. So in terms of which country worked better in terms of the graduation approach, I think the example that I gave, I think there was actually only one country where it didn't work very well, was in Honduras. And this is just because of a process issue in the fact that the assets that were provided actually died after a few months, and then it just had an effect in the entire program. But I think for most of the evaluation that we have on the graduation approach, what I think is interesting is that we find like almost everywhere positive effects. And I didn't mention like a current study that we are doing in collaboration with the World Bank in Niger, in an area where it's very, very poor, where we find also very, very important impact of this type of approach. So I would say that most of the countries, at least that I know of, where this type of programs have been implemented, show like positive result in the short and medium run. Then there is, of course, this question of what's the long-lasting effect of those programs. And I think here there are, of course, we're waiting for some more sites to get data on that, but there are a few sites that show, like in India, for instance, like long-term impacts that sustain. I think in other countries, maybe the effect is a bit more nuanced. So that's one thing. The other question I think was about maybe microloans versus like cash transfer. And I think that's true that in many evaluation of microfinance program have shown results that are not always so promising, in the sense that they do not seem to transform like significantly the lives of people. And here it's not clear why we have a difference between cash transfer or credit programs. Maybe one reason is that many microcredit programs, of course, have interest rates that are maybe higher than what poor people can generate in their investments. But one possibility also is that we are not targeting the same population, and then this is also why we get different results. And maybe just to go quick, one of the first questions was on labeling and literacy rate. So of course, that's true that I'm not saying that this labeling transfer or cash transfer could work everywhere. But I think the example of Morocco is I think interesting, because this is a place where the program was implemented in rural areas, and I guess the figures may be a bit different, but there are also probably a lot of people that were illiterate in those areas and still worked. And also it has to do with the campaign that was done to actually make education salient for the households.
Thank you. Thanks, William. Nora, do you have any points you want to?
The only point I would add is I definitely understand the minister's point around the success of what I think tends to be the majority of productive asset programs in Egypt, which tend to be around livestock, and whether they really are able to elevate people out of poverty. And I think in our experience as well, we have not seen tremendous results with that have sustained, particularly if you introduce a shock. However, I would say that in Beb Amal, I think there are a number of things that are different, and one is really the other component. So I think the idea of having that with savings, and the idea of savings being a means by which, if there is a shock, that they can basically delve into their savings, support them at least for a period of time until that there is coaching. So I think while those people, even in the choice of assets, so those people are not given money, they're given sort of a menu of assets that was based on, you know, a market assessment study that was done. And so they're given a menu of productive assets to choose from, but they're also guided, right? They're guided to think about their skills, about what asset would match the family, about, you know, the other assets that their neighbors have taken. So I think that's why I'm saying, I think the element of hand holding has been very important, and the element of saving has been very important, and financial literacy. So I believe that that perhaps would probably explain why the results for Bab Amal, even though they've had the common of productive asset, which is common amongst many development programs. And I think even in the other countries, when we look at Bangladesh, etc., I think livestock was also the prominent productive asset due to the nature of those rural areas. But I think the results tended to be quite significant and sustained for a number of years because of the other components. And then finally, I would say that, you know, as we were thinking ourselves of, you know, this is not going to be another project where we're going to give them, you know, cattle and sheep and this and that. But at the end of the day, when we went to those communities and when you really look, they're very low skill, very, very low skilled sort of communities. And I think that, you know, the nature of the agricultural nature of the community, what they know what to do, what they want to do. And we're also trying to empower them through choice and have them, you know, have programs that they actually want to do to sustain, has ended up leading us that 70% of our sample has basically taken livestock, and the others are various other productive assets that are non-livestock based. So I'm curious to see our results, but I'm hopeful about it. But I think that doesn't say that, you know, a model that I think is being now deployed in Forsa, which is, you know, bringing a group of women, for example, to work in a collective kitchen with everyone taking part of the value chain. It's just a very different model. But the group we're working with is a very low scale, sort of ultra poor, but I know that the Kafala and Karama has a wide base where they're all poor, but they're poor at different levels. So maybe this works for, you know, ones that are closer to the poverty line versus the ones that are really far below. I don't know, because it's all sort of, you know, my guess is as good as anyone else's. But I think that the inclusion of other components in Bab Amal is what makes it unique versus just another productive asset transfer program.
Thank you very much. And if I may add a point, I mean, I think we need to often look at what happens in some countries in Europe, as they have very old social welfare models, and all these models have now shifted towards more tailored approach to the individual. So there isn't a standard path for each person. So you might have someone that is very close to the poverty line. Maybe they require first some cash transfer, some others which don't have some skills and are not as poor as the others. That it's about training. So it's very famous, the model in Chile, also in Germany, also in the UK. So you have social workers that follow an individual with a tailored approach, with specific benefits that serve that family only. And I think probably it's something that as Egypt, as a country, we need to start thinking of as this model, social welfare, social protection evolves over time. Maybe this is also the next stage for social protection in Egypt. We only have one question, which is, I think, a very interesting question for Dr. Divine. As in your remarks, you highlighted the role of civil society, of NGOs. And this is something that often we don't see. We see at least a coordinated response between NGOs and government. So the question is really about if there are some lessons that you can offer on working between government and civil society in this context, in this response.
Thank you very much, Faisal, for question. And I think the coordination between ministries or between the government and the NGO sector at large is turned to be a must during, it's not only during this period, but even after. And I would add also the religious institutions. And I was just speaking with Jeremy this morning about the zakat issue and how much can we really have a unified database for social protection interventions, whether it's cash transfer or in kind. I think the issue of coordination in order to ensure that the services are equally distributed or distributed fairly, let's say not equally necessarily, but fairly, and we really don't leave anybody behind, because according to the previous period, I would bet that there are people who are behind, and there are categories that are not looked into that much, and it tends to be more and more clear when we serve down at the bottom level. The issue would require first to have a unified database, to have agreements amongst ourselves to improve the governance process. Not necessarily the issue of being transparent, and this actually, I mean the government as much as the NGOs. We need to improve our governance mechanism to see who is doing what, where, and how much is being spent on this. Maybe sometimes the governments are not happy about it, or the NGOs feel that they are being micromanaged. It's not micromanagement either or. It's not actually exchanging guilds. It's just an issue of coordination, having a unified paradigm for serving the poor and for reaching, for really serving in the different geographic areas and the different sectors. It has to be a willing, both partners are willing, our three partners actually are willing to really do it, because in the zakat and also in the Christian donations, religious donations, sometimes they are intending to serve specific sectors and not others. So it's accepted, no problem. But I think having this unified together would really serve the poverty cause at large. This is number one. Number two, we have to sell the cause of social protection. Maybe the NGOs are providing dispersed interventions, but they don't call it social protection. Actually, the perception of social protection is not unified, neither amongst the government partners nor among the NGOs and the government. I think the social protection about what we're doing, what does it mean, and how does it add to an integrated level of comprehensive social protection interventions, if we really want to measure how much people move from this step to another step at the poverty level. The third thing is the MIS, information management systems and monitoring. I would say that there is no monitoring without information systems. And this would require that we all have automation, not only for the government, but for NGOs, and to have everybody registered using their IDs, which is a great challenge for many partners that they see this as a headache. But I mean, it would be a headache at the beginning, but afterwards we will have clear picture how much this citizen took as package of rights, and how much does this cost, and what is the impact of this, and how much also the lost opportunities. If we don't provide this service, how would this be calculated from another aspect? So I think the coordination and the partnership with NGOs, the trust has to be built between everybody's, it's between the government and itself, between the government and NGOs. We're having religious institutions also as well. I think we need to trust each other and to do this transparently, and to have it unified in a methodological manner and automated. And last but not least, it's not the NGOs. There are persons who are serving as well, and who are providing whether zakat or social assistance, but they are not seen. It's not documented. I mean, having grants or having collective social assistance, it happens even amongst families. So I think verifying this or coordinating with NGOs or with government to ensure that this family did not receive from anywhere, I would say that it's required. If it is a small assistance, khalas, no problem. But I mean, if there are constant social assistance packages that are provided by households, which really happens, would be great. And then linking all of this with social insurance, because most of those who are provided with cash transfer are either informal or unseen. I would give you an example about domestic labor, which is not even formalized in a way or another, because they are not seen at all. But we can have this more appealing if we provide health insurance, social insurance, life insurance. It has to be really appealing not only to the government and NGOs, but to the citizens themselves. Thank you very much.
Thank you very much, Dr. Naveen. I think it's this point about the social insurance. I think it's something that you're working on, that you're trying to really strengthen. And there is really need here in Egypt. We cannot rely only on the contributory or non-contributory schemes, but the non-contributory components will need to be an important element of the evolution of social protection here in Egypt. I think we don't have any more time, and I want to thank again Dr. Naveen for her time and for staying with us throughout the webinar.
Pleasure.
And William and Nora as well, thank you very much. Hopefully we'll be meeting in person soon. So thanks to all the participants. So we're gonna share the recording. We're gonna share also the briefing, the seminar brief that we have developed. And stay tuned for the next webinar. So thank you very much and have a good afternoon.
Thank you.
Thank you.